Good day, everyone. Welcome to another episode of the Circle Direct podcast. And today, we're going to dive into a very important complication of diabetes. And diabetes is a condition that affects a lot of people in our landscape today. This complication is called diabetic nephropathy. If you know anyone or if you yourself are suffering from diabetes, this episode is especially for you because we're going to dive into things that need to be done to manage this condition, things to look out for if this condition is already being had or this complication has already been had by you or by your loved one, things to look out for, investigations to be done, and treatment modules that will be able to effectively manage this condition or slow the progression of this condition to something way worse. What is diabetic nephropathy? Diabetic nephropathy, it's in the word nephropathy. That is, if there is a pathology of your kidneys. It is known as a diabetic kidney disease. So it's a diabetic kidney disease, diabetic nephropathy. And it's a common complication of both type 1 and type 2 diabetes. Now, how does this come about? It comes about when high blood sugar levels over time damage the kidneys filtering units. Now, from what we've spoken about before about the filtering units, we know that the kidneys are very important in driving away unwanted materials or unwanted substances from our blood and making sure that important things also are not being excreted away through our urine. They are the ones that maintain the balance of good and bad minerals in our blood effectively in our body, including our BP and including the blood sugar level. Now, if there's high blood sugar level, it gives an overwhelming effect on the kidneys, leading to damage of the nephrons, which are the instruments that are effective at filtering waste from the blood. Now, research has indicated that 30% to 40% of individuals that are living with diabetes will eventually develop diabetic nephropathy at some point in their life. So this is very concerning because there is an increase of rising rates in diabetes globally. So how does diabetic nephropathy develop? It develops in stages, starting with hyperfiltration, where the kidney initially filters more blood due to increased pressure, but over time, this hyperfiltration leads to damage and scarring, which can cause the kidneys to start leaking protein. And when they leak protein into the urine, what we call this condition is called proteinuria. What are the stages? Stage 1, hyperfiltration. That is represented in increased glomerular filtration rate, approximately double of the normal value. So the GFR is usually what we use to see if the kidneys are filtering properly. Secondly, we start having small protein, leakage of small microalbuminuria, small levels of protein through the kidney. They start appearing in the urine. Then stage 3, the microalbuminuria progresses to macroalbuminuria, which is characterized by significant protein leakage. Stage 4 is when there is now a decline in kidney function, leading to end-stage renal disease. Here, it might require dialysis or a kidney transplant. So what are the risk factors for diabetic nephropathy? Of course, with diabetic nephropathy, the major risk factor is if you have uncontrolled diabetes for a longer time. It increases your chances of having kidney damage, especially if you are not able to control your blood sugar level effectively. If your blood glucose is continually high or stays high, or your blood pressure also stays high, there's a high chance of you developing diabetic nephropathy. And also, genetically, people, African Americans, American Indians, Africans themselves, Hispanics, Latinos, when they develop diabetes, kidney disease or kidney failure occurs at a higher rate for them compared to Caucasians. Also, you are more likely to develop kidney disease if you have diabetes and you smoke, or you do not follow a diabetic meal plan, you eat meals that are high in salt, you have a sedentary lifestyle and do not physically exercise as or have an active lifestyle as proposed, if you are overweight, if you have a heart disease, if you want to say, okay, do I have diabetic nephropathy? The symptoms may not be apparent, but as the disease progresses gradually, common signs that you can see are swelling in the hands and feet, edema. If you press your leg or if you press your limbs, you start seeing an indentation in your leg. So once you see something like that, that is what is called an edema. That means you have swelling in your feet or swelling in your hands. When you increasingly become more fatigued, if there are changes in your urine output, so typically someone with diabetes usually has what is called polyuria. That is, you continuously feel the need to go and urinate, and you urinate more often than you typically would. Maybe before you used to urinate maybe 4 to 6 times a day, but now you're noticing that you go to the toilet 10 to 12 times a day. That is what we call polyuria. So you see a change in your urine output. Nausea and vomiting can also occur. Shortness of breath too can also occur, because kidneys are very, very crucial organs in your body. It is very essential for people that are living with diabetes to have regular kidney function tests so that they can monitor if there are any early signs of nephropathy that they might have missed because they do not see any symptoms. Now, what's the prevention and what is the management that we need to go through when we have diabetes? First of all, you need to control your blood sugar levels. If you are managing diabetes, you need to go to your healthcare provider and get the right appropriate medications that will regulate your blood sugar levels. Also get a glucometer and check your blood sugar levels constantly so that you can have a hang of what is effective, what medications are effective for you and your blood sugar level. Always be very transparent with your healthcare provider and make sure they understand that, okay, this drug works for me, this drug doesn't work for me. Maybe I should take it at night, maybe I should take it in the morning. So that a treatment plan of controlling your blood sugar would be well detailed and well tailored to you yourself. Because what can work for you in terms of controlling your blood sugar may not work for somebody else. So you have to be very transparent with your healthcare provider so that the treatment plan is tailored specifically to you. That also comes about with managing your blood pressure. Maintaining a healthy blood pressure is vital because the target is to have 140/90 and below. So medications like ACE inhibitors or ACE receptor blockers also help in managing your blood pressure. As I stated before, what will work for you, the dosage that may work for you in terms of controlling your blood pressure may not be the one that will work for somebody else. So be transparent with your healthcare provider so that you can use the exact medications that will work for your blood pressure. Thirdly, maintain a healthy diet. There's what we call a diabetic meal plan. Diets that are low in sodium, saturated fats, refined sugars can help maintain your blood sugar in case of patients that have diabetes, or even your blood pressure in case of patients that have hypertension. Eating a variety of fruits, vegetables, whole grains, and lean proteins are also beneficial. Fourthly and lastly, regular checkups. Because as a patient living with diabetes, you have to understand that you have to make sure that your organs are not being severely affected. Because if you control your sugar level, your organs are able to be relieved of stress. But if your blood sugar levels are not controlled, then your kidneys start feeling overwhelmed, which can lead to diabetic nephropathy. So regular health checkups are very essential to monitor your kidney function and to monitor if there's any protein in your urine, especially for early detection of progression and early intervention so that the progression does not get to a place that it cannot return from. If diabetic nephropathy does develop, it is very important to work closely with your healthcare team and your healthcare provider, because treatments that have been stated above, like dietary adjustments, medications to lower your blood pressure and manage your diabetes, will become much more important at that stage. Because if it gets to advanced cases, then that's where we get into dialysis or kidney transplantation as your only options. So that's why it is very, very important to be proactive in this stead. In conclusion, understanding diabetic nephropathy is crucial for people that are living with diabetes because you have to understand that you do not want diabetes to progress to a complication of your kidneys being affected. So you have to be proactive in your management of your blood sugar levels, of your blood pressure. Regular monitoring, regular checkups need to be done, and also maintaining a healthy lifestyle can significantly impact your kidney health and prevent you from progressing to diabetic nephropathy. Having a really good overall well-being will make you feel good and will also make your kidneys feel good. And thank you for treating them the proper way. Thank you for joining me today at Seco Direct Podcast. If you have any questions regarding diabetic nephropathy, please be sure to leave comments in the comment section below. Any questions, we'll be sure to get to them as soon as we can. Also, if you have any suggestions or any topics that you want us to carry on, please also leave the comment section below too. We'll be sure to get to them. Thank you for coming and listening to this episode of the Seco Direct Podcast. I remain your host, Dr. Tiwa, and I'll see you some other time.